today we will be having our demonstration about infant care. Okay, so what's the composition of your infant care? We have infant bathing, cleaning bottles and sterilization, and feeding, infant feeding. So what are the things we need? For the bathing, we have, we have new clothes, diaper, yan. We have towels, yan. Small towels, ito mga new clothes. We have your gloves, we have your cotton balls, we have your tape measure, your thermometer. This is your timpani, timpani, and your
body temperature.
oral, or it can be your inal.
Oral and anal.
Oral ito ang itsura niya, pero it's supposed to be the anal thermometer.
For baby po.
For baby. Okay, so we have your lotions, and then we have your weighing scale. Saan siya? Oh, we have your shampoo. Ayan. Shampoo and your soap. And then we have your tub. We have two types of tub. It can be like this, which is usually sa hospitals. Merong ganon, like this one. You can use it even at home.
Yeah, meron kami
Versus
niyan.
sa portable na tub sa bahay.
Meron din kami niyan.
And then, yun. And then for our sterilization and bottles, of course, we have your sterilizer. We have your basins.
Basin.
We have two basins. One tray. Your tong. Your brush, big and small brush.
For the
For nipples, that's for cleaning and your sterilization.
For the
And we have,
bottle,
of course, your
your
milk
milk.
for your feeding. Okay? So, to start, let's begin with our bathing. So, first and foremost, what is the main thing that you have to do?
check the temperature.
Now, aside from that, what is your first procedure? Ginawa niyo yan. Pinakauna niyo.
Waivers.
Waivers. Oh, sorry.
So what is
Sorry.
the tendency with most graduating students, magka-graduate na lang waivers, kinalimutan. Waivers is very
First thing
important.
first pala.
Yeah, first thing first pala. Not the step. Yeah, okay.
Everything. Okay, waivers. Before you
Waivers.
enter the patient's room, of course, you have to wash your hands. And then, if I will be your TO, I want your waivers to be
Actual.
performed. I don't want you to, Ma'am, I will do my waivers, wash my hands,
And get it.
gather my equipment, ganito. So, you can do just, I'm washing my hands, and then, I will gather my equipments. My equipments are my new clothes, cotton balls, say everything what you have. For your equipments, you have to announce yourself. Knock the door. So I will go to the patient's room, knock the door. Good morning, ma'am. I am Hannah, your nurse for the day. I will be doing the infant care. I will bath your baby and I will feed your baby. Okay, may I have your name, please? Okay, that is already what? I am already done with announcement. Explain.
Explain and
Okay, so I have your name. Verify. How are you going to verify? What is the important things that you have to verify? Sige nga.
sa MRN, complete name and the birthplace.
So what is the difference with adult verification? With this time you have two patients or you have two residents. You have the mother and
And the
the
baby.
baby. Of course, you have to verify also the baby. Babies, especially newborns at hospitals, they have
Name tags.
So how are you going to verify? You just do not ask the mother, Mom, may I have your name? After that, you're done. No. The way you verify is that you ask the mother
What is
complete name. Okay? And then you have to verify also with the
baby?
baby's tag. And then, Mom, what's the name of your baby? Usually, they have only baby girl Ibrahim, baby girl like this. So you will have to check the ID band, and if they will allow, Ma'am, can I check the
ID band.
gender of your baby? Because there are tendency that they say,
Mali.
yes, baby girl, oh. Yes. But the baby is not,
Girl.
actually, it's not her child. So you have to check the band, check the gender, if it's right. Is it baby girl or baby boy on the band? Okay, and then MRN, okay, the date of birth. Okay, that is how you verify with the child. Because there are tendency, although it's not, it's rare case, pero still we have to be very careful. For safety, of course, for you and the mother and the family also. So you have to verify, compare it with the tag of the mother and the tag of the baby. And then double check. Is it really baby girl or baby boy? But of course, you have to ask the permission of the mother. Okay? After verification, I'm done with my verification. You have to, what's your next?
Vital sign.
So, reverse pa tayo.
Kala ko tapos na.
We're done explaining, right? So, we are already.
The safe, no.
Privacy,
R, you have to.
Respect.
So, you have to.
Respect.
Privacy. Mom, I will close the
Respect
curtain.
privacy.
I will close the door. If there is someone inside, okay, you can ask them to go out for a while. And then, of course, the safety.
The safety.
What are the things you have to make sure? The level of the bed or the level,
level of the
crib, level of your working area. This for this kind of tub, it can be adjusted. Kaya lang ito sira kasi ito eh. Actually, it can be adjusted to the waist level. And for your tab, portable tab, you place it on the
table
that is, you place it on the table that you think you can. Sige, Ma'am, nice.
Pasok.
Oh. You can place it on the table that is on the level of for you to easily do your batting. Okay? Now, what else? Safety. For example, if there is wheels, lock the wheels. Okay. Now we're done already preparing everything. And then you will tell the mother, Mom, I'll just prepare my things. I'll just prepare my equipments. And then I will start with the batting. So you have to make sure you prepare first the water. The temperature of the water should be 37. If there is no thermometer, what are you going to do?
Or
Why are you using your hand? Seryoso?
No.
Hindi ko sa inyo. No, if there is no thermometer, in your ADL, what did you do? How are you going to check it?
we use
Yes, very good.
The
Your
elbow?
elbow. What's the reason why we use our elbow rather than our hands?
Because elbow is clean, much cleaner than the
Correct.
hands.
Your elbow is cleaner than your hands, of course. And then if you are preparing your things, you have to wear your gloves. If you put it like this, the gloves is still unclean and the sensory of your hands is not that the senses is not sensitive with the gloves and without the gloves. So try ninyo. Pag may gloves kayo, hindi siya ganun ka.
Sensitive.
So maybe you will feel the temperature is okay. It's not warm, pero actually
It's not accurate.
it's not accurate. It's actually hot for the baby.
For the baby, it's too hot.
So you have to check it with your
Elbow.
elbow. Now so you already prepared the water. You have to turn off or lower down the AC. Why are you going to turn down or turn off the AC?
So the baby
High
will experience
hypothermia, yes. Your baby or the infants are still, their thermoregulation is still not normal. So they are very sensitive to having the hypothermia or chills. Okay? So now, Mom, I will get your baby. I will bath your baby. So I will wear my gloves.
Ma'am, during the assessment of infant care, ganyan din po yung magiging namin, parang scenario na we're narrative.
Yes, it's
Ano
that.
pa Sir Arnel?
Actually, I am practicing. I prefer my students to do the narrative of kwan. Kasi nga usually pag sa ADL, mas gusto ko yung pasyente ninyo is not the mannequin, not the dummy. Pag ako ang nag-ADL, you have to practice yourself that you talk to your patient, not just because if you go to your patient, you will not do W verse W is I have to wash my hands. No, you have to do it actual. So you have to practice, at least masanay kayo on what to do.
Ginagawa.
Oo.
Sorry po.
Okay, so now, Ma'am, I will get your baby to check the what's this, to do the
Batting.
batting. So how are you going to hold the baby?
Hold the head,
Head.
back of the head, and then
So
And
what do
then
you call that?
football.
Football.
Why is it football hold? Because
It's like
Like this.
okay.
how you
Or you can do it like this. Hindi pa naman tayo magpapalikod. Okay. So what are the things that you have to do first before you do the procedure? Always check your
Temperature.
temperature. Very good. So what is the accurate way of checking the temperature for infants? Tympanic and anal. Why is it the anal? Especially for newborns. For newborns, we advise to check via anal.
madaling ma-detect.
Inner checking is inner.
Yes,
Anal.
and we have to check if there is hole or not.
Okay. That's
If
the
the anal
rationale.
Yes. So the reason why, aside from the because of the nerves that is present on the anal, also we have to check to
If
confirm
there is a
if there
hole.
is
There's a
anal
hole.
hole. Okay? So we do it tympanic or
Tympanic,
anal.
anal.
For after 24 hours newborn care, usually we use already the tympanic. Okay? Now,
So after 24 hours, pwede na natin gamitin yung tympanic
Pwede na.
with the newborn.
Pero
kung hindi pa,
pero
Or
pag
very
newborn,
newborn talaga.
immediately after birth, you have to check
check.
it anal. Okay? Now, you already done with your vital signs. So you have to check the temperature. The normal temperature for infant is
34,
34.5.
34.2 to
34.
35.2.
Are you sure 34 or 36? Sige nga.
Kasi ibang sa atin.
Diba sa adult yan?
Oh, iba ang sa adult is
Parang
36.
34 point, mas mababa ang sa
Mas mababa sa
Kasi nga their thermoregulation is not still not normal. Oh.
Very sensitive pa.
I think it's 36.2 something.
Higher po ang sa
Sa
baby.
new
Parang
Mas
30.
mainit yung
Mas mainit there.
99.4 to 99.7.
Fahrenheit.
Fahrenheit.
Celsius.
So no, in temperature, in degree
36.2?
Celsius. In degree Celsius.
36.2 yata. 36.
Ah, 36.
36.2.
36, ayan.
Ito.
0 to
0 to 35.5, 37 to 37.
37. Okay.
So 37 po.
35.5 to 37.5. Parang kwan lang din siya.
Panganag naman 35.5
Hindi,
to
range.
Range siya.
35.5 to 37.5. Yung range. Okay. So now, if there is any discrepancy with the temperature, you have to, what? What are you going to do?
To inform.
Report it to your supervisor or to your nurse, and then you will do not do the procedure. Now, after that one, you have to, there are two ways. Kasi maybe you will be
Sorry.
asked.
Sa infant care, di ba, procedure natin as always is laging merong vital signs. Ang complete vital signs din ba ang gagawin sa baby without hindi lang kasali yung pain scale?
No.
Hindi.
Temperature.
Lang talaga.
Temperature lang. Okay. For batting. So, now you will notice on your manual kasi we have recent update from TESDA. So what we talk with Sir June is that we will have to teach you the proper way to answer or what are you going to do. Kasi on your manual, if you able to read your manual, what is written there is after that you have to check the diaper immediately and then change or do the cleaning. Now, there is some instances that in sa TESDA, what is better to do is to clean first the face, and then the head bago tayo mag-change
Change
ng
diaper.
The rationale is that if you remove the diaper immediately or change the diaper immediately, there is the tendency that they will
Pee again.
pee again. So you have to do the process again.
Yeah.
Oh, so that is the first procedure. You can do the head, the face first, and then the head, and then you change. You do not have to remove everything. Okay. So after that, you change or remove the diaper. If there is
PP or
urine or stool. But the other way is you have to check if there is. So you just have to expose the part that you have to change. Okay? Kailangan ko ng extra konti lang.
First mo nga yun. Okay.
So during your assessment, you just have to tell me, Ma'am, I will do the removal of the diaper first because the child already is
there's a
soiled with stool or
PP.
soiled with stool and
Urine.
urine. So the rationale we have to, it is just the way you explain it. Okay? Like the situation is if the child or the infant is already soiled with soiled with stool and urine, that I will change first the stool and urine. If the child, for example, you will check, there is no stool and then there is no urine, you can close, okay, you can cover them, and then then you can wash the face. Okay? So now what I will do first now is, for example, my infant. So i-follow muna natin yung sa manual ha, so that you will not be confused. So what I will do now, I will check if there is stool, there is urine. So I have to clean my baby because he is already soiled with
urine and stool.
So we have to, there is water ha.
Okay.
Water, you have to clean side.
Room temp po yung water.
Same pa rin. Di ba
Yeah.
previously you checked the temperature?
George, attendance.
Di ba,
Thank you.
before you begin, you have to check the temperature, di ba, of the water. So kuha ka lang ng konti and then you make sure you clean the groin. Kumbaga, you do the perineal care and then you discard. Then you clean it properly. Okay. You clean the stool, remove the stool, and then you discard. And then you have to make sure you roll it properly, and then you discard. Okay. So after that one, since I touched the
baby.
stool and the urine,
Change
I
the
have to
gloves.
change
the gloves.
my gloves, and then do my hand rub. It's okay if you're not going to do your hand wash, you do your hand rub. Put another gloves. Okay, hindi ako magtatanggal ha kasi sayang yung gloves natin. So put another gloves and then cover your babies so that they will not feel cold. So once you already introduce the water to the baby, of course they will develop chills or they will easily
freezing.
get cold. So you have to cover them since you are going to expose only or clean only the
face.
Okay, so I will get another water. So do not ever leave your babies
Babies
unattended. There is a tendency of
falling.
So dapat you have already your water for washing your face, for washing the face. So I will remove my
Hat.
Wala tayong hamper.
Walang hamper.
Hindi ko magawa ng hamper. Ito na lang.
It's big market.
Attendance. Uy, sila muna. Salamat.
Okay. For example, this is your hamper. So yan. So how are we going to clean? Of course, you have to use cotton balls from the inner canthus to the outer canthus. Then discard.
Sige. Sige.
Inner canthus to the outer canthus. Now, if you notice that there is still dirt in the eyes of the baby, you can repeat. And never use a soap for face
Baby.
of the baby. Only water.
Water.
And then,
Water.
you can start from the forehead.
Down.
And then down to the chin. You can do the C motion up to
chin.
chin. Yan. And then discard. Then another side. From the forehead
to cheek. Then
to
to
cheek.
So, parang ano
The
din siya sa
chin.
ano, ADL.
And then your
Chin.
then you can clean the nose.
Nose
This
line.
yan, nose line if there is dirt. Yan. And then if there is from the mouth, if there is dirt from the mouth, you will not use cotton balls. You can use ano to? That yung gauze. Oh, gauze or cotton kasi there is tendency na may himulmul. If there is gauze, you can use that one dito lang naman eh. At the outer of
Outer of the
of
lips.
the lips. And then you can clean from the ears, inner, outer, and then at the back of the ears and here, especially on the neck, lalo na pag they are
Yeah,
already feeding.
yeah.
There are
And
tendencies that there is
mabaho, yeah.
milk contents or hair that will deposit in the neck. And then on the other side, inner, outer, okay, clean and then discard.
So, from ear, inner, outer.
Inner, outer, then sa
Down,
neck. Diretso sa
down,
neck.
not
The
sa
neck.
There is a
Oh,
neck.
neck.
Neckline.
Now you're done with the face of the baby.
So,
You can already clean your take the baby for head wash. So you can undress the baby.
Excuse me. Inner.
Or you can use, di ba meron tayong yung pangbata. Yun na nga kanina. Sabi ko,
Oo.
you can use the, if there is no, wala kasi tayo eh. Meron yung pang brush ng for baby. Meron. If there is, kung wala yun, you can make use of the gauze. Oo. But make sure that you will be careful. Kasi magaspang yung gauze. Okay? Slowly remove the clothes of the baby. This is a dummy baby, so they are not moving. The actual babies, they are very
active.
active, very movable. Okay. You cover again. Okay. And then, you can prepare your
Towel.
towel. Dito na yan. And then, okay. How are you going to bring your baby? What do you call this one?
Football hold.
Okay.
Oh, football hold.
Parang sa rugby na po.
So, I will wash the head of my baby. So, I will put a little amount of, so first you have to wet the head of the baby. Then, wash. Then, put a little amount of soap or shampoo. Yan, head only. And then, if there is whitish, whitish content or yung this yung mga parang particle on the head of the baby or the body of the baby, what do you term that one? After
Parang
birth.
siyang dandruff mo na nakatikit.
Oh.
Basta yung puti-puti sa katawan ng
Sa
body.
katawan.
Ng katawan ng baby. Yeah.
Parang
So
ano.
after birth, this is normal. Okay? This is called vernix caseosa.
Vernix cashew.
Vernix caseosa.
B-E-R.
V-E-R-N-I-S. Okay?
Caseosa.
Right, yes, it's vernix caseosa. It's normal for
The baby.
infants, especially newborn.
Okay.
Maybe if you, I do not know the practice here in Saudi Arabia, but in Philippines kasi, we don't bath the baby immediately after birth.
Yes.
So there is the tendency that you will still see this whitish thing on the body of the
Sa
babies.
Philippines.
Sa Philippines. Because it is a protection for the baby's thermoregulation. Before, before during our school years, immediately after birth, wino-wash namin yung baby to remove that vernix caseosa. But recent update, you don't wash it. That's why, if you will notice in the Philippines, immediately after birth, they are doing the unang yakap program.
Yes, ma'am.
With the nanay.
Give it to mother, yeah.
Immediately after birth, ilalagay nila yan sa pants. Unang yakap. They will not clean the baby. Kasi it's because parang you will give them time to adjust to the environment outside.
Okay.
For the thermoregulation. That is the recent update. Kasi the tendency is that they are used with the temperature inside the womb, and then if they are already if they are already delivered, and then you will introduce water, that is the tendency they will develop the hypothermia or the chills. And then after that one, after 24 hours, you can bath the baby.
After 24
Oo.
hours.
So in Philippine practice, of course, I am telling you what is the Philippine practice. Since you are also going to take the NC2, you might be asked, no? So after 24 hours, it is mandatory for you to bath the baby. Okay? So how are you? So after that one, I will already shampoo the head. Make it as quick as possible to avoid hypothermia or
Hypothermia.
chills of the baby. Okay, so you wash, make sure that there is no bloody content or the whitish will be removed. Okay, and then after that, you can rinse. After rinsing, you can bring the baby back. Okay.
Ang kaya ng baby.
You can put the baby back and you can
Wipe.
pat dry. Now I am already ready to pat the baby. Okay?
Sino na ang mga nanay?
Sila lahat. Except me.
Hindi, si Jen hindi pa din.
Ay,
Ikaw, si Tarhas is not a mother. PJ nanay ka na rin.
So now the baby
Hindi
is
na.
ready for bathing.
Pero nakapag-alaga
I
na ako
will
ng
prepare
baby.
my towel.
Nagawa ko na ito.
BJ, ikaw na lang daw ang baby ni Ate Jen.
Ikaw yung papaliguan ko dyan. Pasaway ka.
Ligo. Naka-football holding ba yun?
Oh, football holdings ka.
Yeah.
Wow, ang ganda na to. Tawan-tawa.
Huwag na tayo mag-umpisa sa
Nanggugulo kayo kayo talaga.
So I will prepare my towel and then make
Bath.
it as quick as possible. You have to wash the body
baby.
of the baby. You have to submerge at least half lang sa body. No need the full
The
body kasi you already clean the
head.
Okay, never. Some students will
Yeah.
no, do not pour. You can put a little amount on your head, on the palm,
So,
or if for example, if you're using like this, you can put a little amount on the cup or yung container, and then put water, and then that's the time you can pour and then rub it to the baby's body, on the armpit, on the groin. Make sure the genitals also is clean, and then you can use your small towel to wipe or for the soap to be, or you can use the soap, but do not
Yeah, it is just like this.
like, and then wash. And after that, if you think the front is already clean,
And the
you
back.
can already clean the back. How are you going to clean the back? See the technique, and then
Okay.
ganun pa rin. Wash the back, wipe, yan. And then rinse. You can rinse, you get another water, rinse. Okay, after rinsing, football hold again.
And do that.
And then pat dry.
Dami niya na
Marami nang lalaga ang bata.
Okay.
Kaya
Yan na lang next.
ito na lang yung mga technique na lang.
Okay.
Gawa na kayo ng baby.
Now, after the bathing, there is another thing that you have to do. You have to check the measurement. You call it anthropometric measurements.
Antrom?
Anthropometric measurements.
Anthropometric.
During your assessment, yata ang gusto ni Sir June is separate yung vital signs and anthropometric. There is bathing, there is sterilization and cleaning, and then there is parang 4 tables yan, sabay-sabay kayo magpe-perform. And then, when are you going to do the anthropometric measurement? Anthropometric measurement can be done immediately after birth for baseline measurement. What are these measurements? We have your head circumference, chest circumference, and the length and the weight. You should measure this measurement when there is no clothes for babies. That's why I told you there is 2 ways: immediately after birth, or if after 24 hours after you bath. Of course, you will not, syempre, if you undress the baby in the first procedure and then you undress him all the way, he will become cold. So that is why it is advisable for you to do the anthropometric when you're done with your bathing and then the baby is already undressed. Okay? Then you have to check the head circumference. What is the normal head circumference? We have 33 to 35.
33 to 35.
Okay? So, how are you going to check?
33 to 35
Centimeter. You will use the centimeter. How are you going to check? From here, from the occipital,
Occipital to frontal.
on the upper of your
Frontal.
Forehead. From down.
eyebrow.
Eyebrow.
Sa eyebrow.
Lining of your eyebrow. 33 to 35.
CM.
Okay? And then, you just slide it
Down to the
chest.
chest.
Your chest is 30 to 33 centimeter.
30 to 33 cm. Ma'am, kapag ka mayroong mga like, for example, hindi na-reach yung ganun size, may mga terms ba na tawag doon? Normal?
Yeah,
Abnormalities.
under kwan siya, the baby is microsomial. When you mean microsomial, is smaller than the normal.
Normal.
When you say
macro naman,
macro is
macrosomia,
big.
it's bigger.
Okay, so it means there is
Micro and
underlying disorder from the mother during pregnancy, kaya siya microsomia.
Microsemia at saka
Microsomia,
Micro at saka macrosomia.
macro and micro.
Micro, pag maliit,
Mostly, pag macrosomia, the mother is diabetic.
diabetic.
In diabetic mothers, there is also possibility for microsomia. It means microsomia is the nutrients goes into the mother. Pero pag ang baby is bigger than the size, the normal size for newborns, it means the nutrients or the sugar quant is goes to the baby. So that is the reason why there is juvenile diabetes for
baby.
babies.
For the baby.
So at childhood, meron na silang
Kaya ko lang
diabetes.
siya naitanong kasi meron akong na-experience na case before na nanganak yung friend ko, tapos sobrang liit talaga nung baby niya, as in halos parang bote lang siya.
But it's normal.
Ano
What
nga
siya?
Hindi siya premature. Hindi po siya premature. Complete talaga siya. Kaso nung dinala na siya sa hospital, ang akala niya tumagilid lang siya, akala niya nadudumi lang siya, pero lumabas na yung baby niya. And then almost 1 year yung naging examinations dun sa baby, and I even myself nag-check ako, nag-research ako ano yung mga possible parang Pierrobin ba yung ganung case. That's very small talaga siya. And then ngayon medyo
Okay na.
hindi lumaki siya pero hindi ganun kasabay ng age.
Niya. That is another condition. That is why if there is macrosomia or microsomia, there is really underlying cause. So that is why the anthropometric measurement is really important for infants and especially for newborns.
Parang ang narinig ko is during her pregnancy is naglulus ang water sa bag niya. Naglulusen. Oo.
Or maybe there is din siya, hereditary.
Kasi di ba ang pregnant woman, there sometimes follow a certain diet.
In some
Hindi
cases.
naman niya.
There are some cases
Very
na
siya kasi nurse din siya eh. Nurse
There are
din
some
siya.
cases, pwede rin genetics. So there are many reasons why babies or
Hereditary.
infants are, they're also hereditary, or there is, if you notice, we have what you call newborn screening.
Oo.
Okay, this newborn screening is to identify those illnesses on the baby. You will see the
History.
baby, they are normal. But there are underlying disorders na hindi na-detect immediately. So the purpose of the newborn screening is for early detection. So yan yung mga cause. So that is why your anthropometric measurements are very important. This measurement is vital and could determine some underlying disorders or abnormalities. Like for example, the head, it is bigger than the normal. There may be hydrocephalus. Okay, so when are you going to check the anthropometric measurement? At birth, and then you can check it after 24 hours after birth. And then there is already every check-up, di ba meron silang weekly kwan, they will check it, monitor it, because the tendency is it will
Developed.
yes, it will add. It is normal to increase the number or the size, but
If it's
one lang siya, half centimeter
Inches.
or half inches, ganun lang. But if it is rapid, the rapid change of measurement, it is it may signify another problem. Okay? So after your chest, yan, you have the measurement of your chest circumference is
35.
on your nipple line.
Nipple line.
Okay. Now you can
Pati pa si baby.
check the weight. I mean the length. So the normal length is usually 50 centimeter. How are you going to check the length?
From the
Since the baby is very moving, you can do it on the side. Okay? On some weighing scale, there is already ready
the measurement.
measurement. Meron siyang parang ruler, and then when you just weigh the baby, you can adjust it. Ganun. Usually sa hospitals meron yun. But for us, since we don't have, you can use the tape measure. Oras na ba? 11:30 pa pala. Okay, you can use the tape measure. At the tip of the head, slightly move slowly. Kasi gumagalaw yung baby eh. So you can slowly like this. Kung mabilisan kayo, you can do it like that. Make sure that the feet is straight. Okay?
Then is
So if not, if he is very moving, you can slowly like that. Kwan lang. Ano yan?
Steady ka lang, baby.
Oo, steady ka lang, baby. Then, kailangan ito naka-straight. So, since hindi siya ma-straight, at the
Assuming
tip of the sole. Yan. So, ilan ito? 38.
steady ka lang.
Pandak ka. Chop. But the normal the normal size is yan, pandak siya 38.
Panda ka, baby.
Anak siya
Alam mo
ni...
yun lang, kung anak kayo, pag Thursday lang.
So anak siya ni Unanay.
Okay? Now you already measure the height. You can measure your
The weight.
weight. The normal weight for babies is at least 3
3 kilo.
kilos to 3.5 kilo.
A newborn baby.
Newborn baby.
Okay.
Okay? So expect, of course, when they already start to feed after 24 hours, pwede na siyang mag-increase. But not the extent na it will increase up to 4 kilos immediately. Siguro point something lang. Okay? Ano yun, magic?
Magic na si baby.
Okay?
Para siya sa...
So why are we going to weigh them without the clothes? Sige nga. Yes. So it will not be accurate to measure the baby if there is clothes. Okay? So how are you going to operate the weighing scale? You have to turn it on. Ito hindi kasi gumagana eh. You have to turn it on and make sure the unit is ano to? Kilos. Kilos or pounds. If it is pounds, what is 1 kilo? 1 kilo, how many pounds? Is it?
2.2.
Yes, it's 2.2 pounds. So, you have to adjust it. There is unit adjustment here. And then, you have to tear it. When you mean tear, kailangan naka-zero siya. Okay?
Iyakan mo daw.
Dapat naka-zero siya. Okay? So after that, you can weigh the baby. Now you're done with your anthropometric measurement. You are ready to dress the baby.
Dress.
Before you dress the baby, you have to clean the cord. Now,
Umbilical.
there is different procedure with cord care. What we are going to do is not the cord care. We just need to make sure that the cord is dry. So, kailangan mo lang siyang i-dry
Pat dry po.
or circular motion from inner to outer,
Outer.
then discard. Then, if it is still dirty, if there is soap or whatsoever in the cord, you can clean again and then
Just a
discard.
cotton, ma'am.
Cotton lang.
Cotton lang daw.
Okay?
Dry cotton.
Dry cotton lang because we have to make it dry. We are not doing the cord care. Okay? Cord care is a separate procedure and it needs a sterile technique. So now we are just drying it since you got the baby, nabasa siya. You have to keep your cord
dry.
clean
And
and
dry.
dry at all times. Because if you don't keep it clean and dry, it may cause infection. Okay? Now, you're done cleaning the cord. You have to put,
Diaper.
if you want to put lotion, it's okay. But never put powder. Yes. What's the reason why we do not put powder?
Rashes.
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 It may cause rashes,
Rashes.
Develop allergy.
Allergies.
and aside from that, the powder may be inhaled by the
Inhale.
baby.
Yeah.
If they will inhale it, there may be problem with the
Respiratory.
there may be problems with the respiratory. They may develop respiratory disorder. Okay. Now, you can use the lotion if you want, or moisturizer, Vaseline, whatever you like, as long as you don't use powder and what?
Oil.
Alcohol. Alcohol. Never use alcohol. Practice before we are doing using alcohol to clean the
To the
but
umbilical.
no, the update now is that it may cause dryness of the skin. Oil, what kind of oil?
Baby oil.
Baby oil is okay, but make sure that you lather, not too much, okay?
Baby.
Just enough to, pero mas better is one
Moisturizer.
moisturizer or lotion is better,
Baby oil.
okay?
Anak ng taong grass.
Kung sa ano ka ma'am, kung sa remote areas,
Yeah,
So,
baby
no,
oil.
Baby oil, yeah.
Baby oil, anak ng taong grass.
Okay.
grass na gusto.
Okay, now you can put on the diaper. Make sure yung
The sticky part.
sticky part is nasa kwan. Ang iba kasi
Sa
halata
likod.
masyadong walang anak, nilalagay sa harap.
Oh, grabe sila. Hindi ba sila nagala? Ay, hindi mas
Yeah.
ganun.
Hindi sila nagpatay.
Ako nag-okay.
Okay.
Pamangkin. Hindi ba sila
Of course, if there is cord, never cover it
Yeah.
with the
Okay, fold it.
fold it.
Yeah.
Because if you put it over the cord, it may cause irritation. So make sure that you do not cover the cord. Before, what we are doing, the old practice, they do the covering, ganun. Now, just leave it.
Oo, yung bigkis. So, yes, yung bigkis sa
Bakit nga
ano.
pala sa atin?
Dati.
Sa anak ko noon.
Oo, binibigkis sa atin.
Bigkis ng ano. Merong
Because they
ganun
say,
pa.
ano yun, parang,
Bloated na yung
pag mahila daw, all this, okay?
Baka para daw hindi mano yung puso. Di ba may puso na
Yung mga bata na nakaranas binigkis, tingnan nyo oh, ang sexy. Tingnan nyo yung hindi binigkis.
Ouch naman.
Okay.
Okay.
Sabi ni BJ, ano yung bigkis yung lalagyan ng baho?
Hindi.
ang
Ay,
sawa.
dapat na naman po.
Ay, lahat tayo, nakabigkis.
Kasi hindi siya tumutulong sa nanay namin dati
Na.
nag-alaga.
May kasunod pa ba si
Wala.
DJ?
Hindi siya
may dalawa
binigkis,
pa.
binigti siya.
Dalawa pa?
Akala ko bunso.
Akala ko bunso siya.
Hindi napabayaan kasi.
Napabayaan ka pala, BJ.
Okay.
Hindi siya
Okay,
binigkis.
now I will
Binigti siya.
Clothes. Put the clothes.
clothe my baby.
Kontra sa aswang daw.
Aswang ka. Walang
Nasanay kasi siya sa lola namin naglalagay ng bawang. Pero hindi niya alam ang big kiss. Okay? Slowly.
Kaya pala yung dyan mo lumabas kasi mag-bigkis na.
Grabe, tinira ka ni ate.
Yan ang kwan sa kanya. Masyado lang malaki yung damit.
Bigkis. Hindi ka nabigkis, kaya nakaganito doon yung tiyan mo.
So, you see ngayon, the baby is very okay, di ba? But, in actual,
Malikot.
malikot yan.
Hindi mo makuha.
Sir, ma'am, pwede po
Yung
mag-sakos
kamay, pag ano
yung
ka-
baby namin.
Pwede.
Bibili tayong barbatos mo.
Yung adult tayo.
Oo.
Paano yung perennial eh? Sino mabili?
Si Ate Jem, siyempre
Lalabas muna tayo lang.
papakailaman pa ba natin yan? Yung privacy niya yun.
Huwag kayong ganyan.
Ma'am, alam niyo ba?
Mamaya maniniwala na si Ma'am
Pili
Hana.
namin bago
Baka
mag-graduation,
pagkawalan na ni Ma'am Hana.
magkakaroon ka na ng hipag, ma'am.
Uy. Parang kwa na.
Opo.
I will be happy.
Walang ano.
Matuloy lang DJ,
Dory,
sagot ko ng
ma'am.
benching.
Maging masaya ako. Sino ba yun?
Oo. Ayun po katabi nyo.
Gabi video. Wala masyadong ano. Ano ba
Ba't
yung
hindi ka
Dory?
nagpapakilala? Okay?
Tikisan ka.
Hindi ka na kailangan mag-Doremi ang gagawin mo.
So libre ng Dory.
Ay, libre na daw po.
Libre na.
Ay, sige.
Si ate-
So, there are
Sige
two
na,
ways
sabi mo
of...
na, Hindi siya magbabayad.
So, sige, pag-aralan nyo, but make sure you are perfect in your... Kwan ha?
Infant
Your
care.
infant care ha?
Parang
Promise ka na.
Parang pag mga
Ha?
nakatawagan ka, ate.
Ay, para ka dyan. So, okay, there are two ways to swaddle. We have your swaddling without cup.
Ano pong swaddle? Ito
Yung walang
yun.
kwan.
Swaddle pala siya.
Swaddle, yan. So,
Ah.
you don't have cup.
Ay, cute.
Ay,
So, make sure na.
nakaitsura mo, BG, pag ginanyan ka namin.
Ganun pala yung ano. Pag,
Okay? Kasi there are some infants that do not have cup. Make sure that you swaddle them not too tight and not too loose. Siyempre, kailangan bigyan nyo rin sila ng area
Space.
to or space to
Galaw-galaw.
Baka kaya hindi na lumaki ka, hindi naman.
But,
Paglaki ko.
but if you notice here sa kwan, usually they do it very tight. Meron pang kung ano-anong tali sa
Parang tayo pa rin siya. Kabigkis pa ulit mo.
Ginawa
Okay.
ng ano, pinasaputan
So this is your swaddling without
Cup.
cup. Okay? That is swaddling without cup. And then swaddle with cup is the easier way.
Oo, madali niya yun.
Kasi may cup na
Kasi
yun.
makeup na yun. lagay lang.
Okay? In a triangular, then you just put the cup.
Oo.
Required talaga, ma'am, na may cup ang baby.
Kasi open pa yung dito niya.
Parang
Okay.
mahanginan.
Since you ask, what are the two fontanelles that is not yet formed?
Yung bunbunan niya, ma'am.
What is that
Bunbunan.
bunbunan? Medical term. Ha?
Frontal.
Yes. Fontanelle.
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 Front.
Di ba I discussed that to you on your... Di ka nakikinig sa lecture, no?
Tulog.
Tulog siguro kayo, no?
Fontanelle.
Front.
It's fontanelle. We have anterior and your
Posterior.
fontanelles. Which one will be closed first?
This one.
What is that one?
Fontanelle. Frontal fontanelle.
Frontal, this is your
Posterior.
posterior and your
Front
anterior
Interior.
fontanelle. How many weeks it will close?
Weeks, 3 weeks, ma'am. 3 weeks to 2 weeks.
At least 1 to 2 weeks.
1 to 2 weeks.
Sa posterior fontanelle. Anterior fontanelle can reach at up to months. Okay? 2 to 3 months, yan. Yung fontanelle. What are the lines on the head of the or the skull of the baby? What are these lines?
Hindi ako na.
Hindi ka sa ulo. No. Hindi ka sa ulo.
Oh, that is the suture lines. Okay? So the suture lines from your frontal, your temporal, yun yung sa gitna, the triangular one, that is your posterior fontanelle. I know, diamond is your posterior fontanelle, your
Book.
anterior
Yung Mickey
fontanelle
Mouse
is
na
your
book.
diamond side.
Mickey
diamond
Mouse na
shape.
book.
Okay?
Notebook.
Kurutin ko kayo sa singit eh.
Meron akong kopya, ma'am.
Pag
Pero
hindi ako,
nakadil ako
pag
sa
hindi
ulo.
ako ang nag-buwan sa
Thank
inyo,
you,
tapos
Leo.
hindi nyo nasagot yan, ay nako.
Sige, wait. Note na.
Okay.
Frontanelle, posterior.
Posterior and your
Anterior
anterior
frontanelle.
fontanelle.
Tapos merong anong tawag doon sa ano sa dito? Yung sa line, sutural, suture lines. Tapos, yung diagonal po, ay, yung diamond.
Diamond shape is your posterior fontanelle.
Posterior.
Your triangular shape is your...
Bakit ganyan drawing mo? Parang
Siyempre,
walnut.
ginaya ko lang.
Parang walnuts.
Terminator.
Para lang siya makuha. Check ko taga.
Malaki talaga siya. Maliit ang ulo mo. Malak ka talaga.
Anterior.
Baka may dwarfish.
Dwarfism siya. Now we're done with your cleaning and
kaya.
batting.
Hindi
Kasi
pa
hindi
kasya.
ma-
Hindi mo makita. Sige, send mo na lang nyo ulit yan sa GC.
So, what are the things you have to remember when are you going to change the diaper? You have to check
First the urine
If there
and
is
the
no
tubes.
urine and stool, you can keep it
Keep
and then you
clean
do
the
The head.
the
face
or
and the
the
head.
So, but if they are already soaked with stool and urine, you have to
Change
first. Okay? Now, for example, if you think the penis of the infant, you can try to retract in cleaning. But if no, it's okay. Kasi infant pa naman yan. Kasi usually here in Saudi Arabia, they immediately after they circumcise already. So if it is not for our practice, diba, it's not uncircumcised. It's uncircumcised. So we will clean the genital area. You have to retract it. Okay? So we're done. After that one, I have to remove my gloves and then do my hand washing, and then you can give the baby to the mother. Ask the mother, do you want me to put it in the crib or you want to hold it? Say, okay, put it in the crib. You can put the baby on the crib. Okay, now we're done. We're cleaning with our bathing. We can proceed with the cleaning. May na feeding, excited? Oh, by the way, your weighing scale, make sure to put something na hindi mabigat. Like for example, towel or tissue. Or in hospitals, they have this bed rolls. Yeah, you can put, or assessment rolls. Underpad, medyo mabigat siya. Okay, bed rolls. Okay, para rin siyang tissue but it's bigger. So you put something that they will not feel
Yung parang
cold.
nilalagay po sa siopaw, naglalagay yung siopaw.
Parang
ganun, di ba?
Parang tissue lang din. Okay. Now I'm ready with my cleaning of bottles. Yan. So what are the things you have? Of course, you have to, hindi na ako magtanggal ng gloves na, sayang ang gloves. So I will prepare.
Sanay naman tayo nagkukunwari.
Oo. Okay. Make sure you have your 2 basins. One is your water. One is your with soap.
With soap.
Okay. Make sure that it is warm. Why do we use warm water?
Para maano yung sa bacteria mo.
Bacteria mo.
Okay.
To prevent bacteria.
To prevent bacteria, yes. And then also to easily soften the residue of the milk inside the bottle. Now, you don't need to measure as long as it's warm, it's comfort. The temperature for you is not too hot.
Good morning, BJ.
Dapat yan.
Ikaw ang una mag-perform.
Siya po ang magde-demo.
Okay. Now, make the soap of course, I will wash my hand and then put on my gloves. Okay? And then, the water, there is already water on it. I will put a soap on the other basin. Make a soap sag. Make sure that you completely dissolve the water, the soap on the water, and then you can soak it. Okay. Now you can soak. After that, you can use the brush. DJ, you have to practice. If you have your child, huwag mo akong tawagin.
Dapat yan.
Mga tawagin mo pa ako, ate, pag kailangan kong
Papaligo. Di ba maate, infant care ka?
Ganito ang magiging sagot mo. Pagka ganyan natatawagin ka ni BJ na, ate, no, nung ginawa mo nga ang bibig, hindi mo naman ako pinawag.
Yes.
Diba?
Oh, tawa-tawa.
Parang yung sa yung mga
Ang ginawa nyo eh.
yak-yak ka, anong ginawa yan eh?
Okay, you have to make sure if there are residue inside, you have to completely brush it or remove it with the, and then you have to clean properly, make sure that there is no more residue. And then you have to put it on the rinsing
Basin.
basin. You can use the small one. Do
Or the
not
nipples.
completely
push.
Push it, maybe it will damage the nipples.
Nipple.
Just
The nipple
slowly,
Circular motion.
circular motion, and then
The outside.
outside. If you think that is already damaged, you can discard
Toss it,
and
yeah.
get a new one. Then, this one. Also include the cup in cleaning because there are water. There is
Masamid na si
milk
baby.
content. And then you have to make sure you brush properly. Now, I have to rinse it. Rinse and then put it in a clean, flat
Tray.
container and then let it
Let it dry.
for a while, or at least the water will just flow. Yan. So you have to clean the area. Now you're done with the cleaning. Remove your gloves, do your hand washing, and then clean the area and set aside. For example, okay. Now I'm ready with my sterilization. The second part of your
Cleaning bottle.
cleaning. So I will again do my hand hygiene and then put on my gloves. And then you have to fill your sterilizer depending on the packaging or as instructed. But the uniform kung talaga
The
is
standard.
the standard way is that 3/4 or 75%. Yeah, it's 3/4. 3/4 of the water. It can be here. Meron namang nakalagay dyan eh. It can be here, 3/4 level or 75% level. Or there are some sterilizers that they put it here. Meron siyang inside and then there is just level, ganon. Tapos
Like
just
steamer.
75% and 3/4. And then you put all the bottles. Put it here. It's okay to hold it kasi kwan pa naman eh, naka-gloves ka pa naman. And then you just have to put it on top. And then you will now wait until it will boil. Once it will boil, you can cover it. Once it will boil, you have to start timing it for 30 minutes. After 2 to 3 minutes, using your tongue, you can take out your tongue, cup. You can take out the cup and the nipples. Why do we have to remove it within 2 to 3 minutes after boiling? Or 3 to 5 minutes.
But it deforms
It can cause deformity.
Deformity.
So you can remove it and then wait for another 25 minutes for the bottle. So the total for the bottle is 30 minutes. Okay? Total for the bottle is 30 minutes. So after that 30 minutes is passed, I can take out it using with your tongs. Yan, that is the purpose. So this is clean ha. Okay. Now you're already ready again. You have to remove your gloves and then do your hand wash. So pwede ko nang tanggalin because on your feeding you don't need to use your
Gloves.
Okay. So, example, this is mine. Now you do not ever touch your. You can hold your bottle but not the
Nipple.
nipples. Oops, sorry. Bawal siya. Okay, you do your hand rub, you do your hand washing again, and then you are now ready for your preparation of your meal. So, dito na tayo. Ay, ayan. You're ready for your feeding. Kulang ako ng isang towel na. Now, for your feeding, I just want to show you this. This is an example of feeding bottle for
Infant.
patient that have infants that is having cleft lip or cleft palate.
Mayroong
It
ano
is
dito.
a congenital disorder. Upon delivery, they have
Yeah.
magkape ka.
Matigas yan, ma'am.
Hindi, malambot lang.
Parang goma lang.
Okay. So make sure that they put inside their mouth properly.
Hindi nababalo yung oka. Ang lao aba naman.
Okay? So this is an example. There is another, yung matigas siya, but it's open here para siyang smooth. So at least you will know and you will not be
Ignorant.
ignorant. Once
Ignorant. Uy, ano yan? Parang ganyan.
There's a nipple for ano po.
For yung may
may
slice, oh.
when you mean cleft lip,
Cleft
what
lip.
is the disorder on
Yung
the lip?
dito.
When it is cleft lip and cleft palate, yung
Yung hiwa dito sa may ano.
yung gums.
Gums.
Okay.
Naka-open.
Okay, so usually at the age of 1 year old, they are being operated for repair. And then once they have already repaired the cleft lip and cleft palate, that is the time you have to very careful when feeding them, kasi there is the tendency that it will have bleeding. Okay, that is just at least you will have the idea on what is the battle for
them.
your cleft lip and cleft palate babies.
Clip, ano? Clip pala.
Now you are ready for your infant feeding. For your infant feeding, of course, you have your milk. You have your bottle. Okay, this is already sterilized or clean. Okay, you can leave it here as long as after 30 minutes you have to turn it off. Okay, and 2 to 3 minutes you have to remove the top part, and then continue to sterilize. Now I'm ready with my feeding. First thing you have to check the expiration. Check the milk. Check for the required amount of water and required amount of milk. Or if there is special direction from your doctors or from your pediatricians that this is the only amount of milk that you can give your baby, you have to follow which one. Is it the milk or
The doctor.
it's the pediatrician's order. Okay? Now, for example, you don't have any idea what is the preparation. You have to double check. So, preparation, how many scoop? It says here 90 ml, 1 scoop. Okay. I will get a water. I will fill it with 90 ml. Okay. For example, I already get the water. Warm water. Okay. Or hot water can be. And then you have to make sure you scoop it. And then you see the other, and yung sa side, you can scoop it like this, but never tak-tak. Make tak-tak. Or
Dapat level lang po talaga.
level lang. Okay? Never do like this, or you never compact. When you mean compact, you make it, what's this? You make it very full inside. You can just, as long as you get the milk and then level it, that is the time you can put it inside. The reason why we don't compact is that to avoid constipation for infants or babies, because compacted milk can cause constipation. Other than that, if you put too much water, too much water and it's too diluted, or too concentrated, it may cause diarrhea. Okay? So, that is the thing that you have to avoid for infants or children, because they are still infants and they don't have the voice to tell you, I am
I'm full.
I am full, I am having diarrhea, or I have bad stomach. The thing that they can do is only cry. Okay? Now, for example, you see that your milk, it is not expired, but you see something inside, there is crawling inside, there is already molds, there is whatever, anything, you have to discard it.
Yeah.
Okay? You have to discard it and change. And then, water first, Water first before the milk. And now you have already your milk or the water. You can never touch
The nipple.
the nipples, especially the tip of the nipple. You can always, of course, if it is your baby, bahala kayo dyan. But if you're working in a hospital, make sure you avoid, that is infectious, it's infection control. Infection control.
It can cause contamination.
Now you can And then you can cover.
And
Do not ever,
do that.
Shake.
why? It can form bubbles.
Bubbles.
It can form the air that may be
Exactly.
ingested in the baby that may cause abdominal distension, abdominal pain, bloated. So the air may cause abdominal pain. That is why the tendency at home, babies, they easily
They're
get
crying.
bloated.
So you
because
just
of-
go like this.
So how are we going
Just
to
like
melt?
this.
Since it is warm or since it is hot, it can easily be dissolved. Like this, circular motion, or
Like,
Okay.
aside from that, aside from that, it
Hindi
is.
ako natutuwa kasi akong pag ganun kasi pag
Bakit paharap?
Hindi.
Oo nga, paharap.
Di ba yung tip ng
Sabi mo ganun.
Oh.
Ganon.
Oh.
Natutuwa kasi
Iba yung sa kanya, ma'am.
hindi pa warm pa yung water. Pagka
Ay, ginaganon pa nila yung
And then the usual practice you're doing
Ganon,
like
oh.
this, which is not.
They cover the ano kasi tonto
What
ako
is the
pagka
use of
binitawan mong ganon yung pressure.
Oh.
Di ba?
Which is not the correct
Correct.
practice.
Diba?
And then after that one, shake it, diba? After shaking, if the water is still hot, you can check
Check.
here. What is the other thing that you have to check aside from the temperature? Or like this?
The concentration of the milk.
No, what else?
Ano ma'am?
Aside from the temperature, you have to check if the milk
milk
is
is
still hot or no. You have to droop a little on your wrist or here.
Here.
Aside from the temperature, what is the thing that you can check by drooping? Yes.
The consistency.
The nipples, no. The nipples hole.
All.
The hole should be enough only for the child to suck.
Suck.
To suck.
Do not let the child suck the milk. When you do like this, there is
Cigarette,
like
yeah.
this. Only enough for the child to suck
Suck.
the milk.
Kasi hindi pa
Okay?
nila alam yung
So you have to
proportion.
check the temperature and also the
The hole.
nipple holes. Now the temperature is still hot. You can put it in a cover it, put it in a running water. Then after that one, you can check again. Now the milk is already good for feeding. You can get the baby. Mom, I will feed your baby. Okay. Then what is the proper position? They should be in semi-upright
Okay.
position.
Semi-upright.
Semi-upright. Why? Because to avoid
Choking.
choking, aspiration.
Aspiration.
And of course, the milk that will get into the mouth of the baby, there is the tendency that it will droop out and then go to the ears or the neck of the baby. It may cause infection. So it's always semi-upright. And do not ever forget
The
Bib.
the bib. I don't know why others are always forgetting to put the bib.
BB.
Halos lahat
Mga
ng
walang anak
na-assess
siguro.
ko, nalilimutan nila yan.
Walang anak siguro, ma'am.
Okay? You can either put immediately the towel on your shoulder or you can put it later, but for your convenience, you can put it immediately para hindi ka na mahirapan. Okay? Now, you are ready to
Feed the
feed.
baby.
Make sure you fill in the nipples with the milk first before you putting. Do not put it on the mouth of the baby that there is no milk here, because if they suck it, there is the tendency that they will suck air. So it may cause abdominal
Abdominal
distension, bloatedness, and then abdominal pain to the baby. Okay? So now you're ready to feed. Now the baby is already full. What is the sign that the baby is already full and they do not want the milk anymore?
Pag lumalabas na yung gatas.
Eh, minsan i-ano nila, i-squeeze, yung tank nila may ano, push it.
Using the
Yeah, tank.
tongue. Now, if the baby, if you want to feed the baby, for example, newborns, usually they do not know that it's already there. You can stimulate the cheek, and then if you try stimulating the cheek of the baby, they will find. Stimulate the cheek, and then okay, you can feed now. Okay, what is the reason why we do not feed the baby on lying position?
Para hindi siya mabulukan.
Aspiration.
The aspiration.
Aspiration.
Now, the baby is full already. Never let them finish or consume all the milk if they are already full. Okay, if they pushes the bottle out, it means they are already full, right? They don't want to take the milk. You can keep the milk on a room temperature, cover it, and store it at least how many hours? 2 to 4 hours. Okay, you can keep it on a room temperature and you can give it within 2 to 4 hours. After 4 hours, you have to dispose. You have to discard. In some books, they say 2 to 3 hours. Okay, but usually we have at least 4 hours. Okay, but if within 4 hours and then you notice that there's already clumps, because it still depends on the temperature. If the temperature of the room is too hot, it may cause the spoiling of the milk. So if you notice before you feed, do not immediately feed. Check the content. If it's still, you think it's still good for feeding, within 2 to 4 hours, you can give it. But if you think that it's already rotten or whatsoever, there is already clumps, you can notice it, so discard. Make another one, it's okay. Okay? Now we're done with your feeding. Okay,
Pabark mo na siya.
now you have to, it's very important to birth the
Pabark na
baby.
siya.
How are you going to birth the baby? That's the
Like
time
that.
you put the baby or hold the
Like
knees. That is the reason why we put the towel, to avoid the tendencies that there will be little milk that will go out of the mouth of the baby. So it is for your protection. You can do like this, never do like this, or never do like this. Okay? Just let the baby burp. If you hear the now you're ready to, you're finished already with the burping of the baby. But it does not mean that after burping, you immediately give the baby to the mother. You can at least hold them in an upright position for at least 30 minutes. Okay? Until all the food content will go to the stomach before putting on the crib or giving to the mother. The tendency, if you put them immediately, there's still maybe regurgitation or the food will still go out. So at least 30 minutes. Just hold them for at least 30 minutes. If you don't want them to hold the baby for 30 minutes, you can put them as long as you put them in a side lying position, so that if there is a milk, it will just go out. Or you can elevate the head of the bed or head of the crib. Usually the crib in hospitals, it can be adjusted na
Ipataas siya.
So there is an adjustment. Pwede siyang ma-adjust na naka-semi-upright na rin yung position. Okay? For nurseries and pediatric units, meron silang ganun na crib. So, we're done with the feeding. You can return the mom. Mom, you want me to put in the crib or you want to hold the baby?
your baby?
You put it in the crib. They don't like it. So, okay.
They don't like the baby.
Okay.
Oh, you don't like the baby? Ito,
So, we're done.
May factor.
Okay? Tapos na tayo.
Ganun na yan. Okay.
So, what are the things? Of course, after the procedure, make sure you
clean up.
The area. Working area.
Also, so you have
Ano
to
yung sukat dito sa ano?
Like the working area.
clean the working area,
30.
dispose and
33 to
everything that
36
is
ata.
needed to be disposed.
33 to
And then,
36 cm.
document. Wait, what are the things you have to document?
Irregularities or
30 to 33.
Okay.
Like
So
that.
during the bathing of your
Saan
baby,
sa
make sure also
titingnan
to
ko.
assess the skin of the baby. Any contractures,
Or
any
rashes.
anything that you will notice,
Inspection.
inspection, you have to document everything. Okay? So, what else? Meron ba siyang moles? Meron ba siyang, there are sometimes there is moles or there is, ano yan. You can take note of
Siguro nung pinanganak ako, hindi na
Ikaw,